The study was novel in the way that it really showed that drug overdose is a pediatric issue. And so pediatricians or pediatric health providers really need to get educated on what are the trends and what's going on.
Dr. Nicholas Chadi, a specialist in adolescent medicine and an addiction researcher at CHU Sainte-Justine Hospital here in Montreal, was the lead investigator in a survey on overdoses amongst children and teenagers aged 12 and over. The study revealed that 128 Canadian pediatricians have dealt with 636 cases of overdoses in the past 2 years in Canada.
It's probably only a matter of time before young people in Quebec are also increasingly affected by this overdose crisis, I would say, that is really present all across North America.
The research involved surveying 934 pediatricians. About 14% of them reported that they had treated at least one overdose for the age group studied. 60% of the overdoses were from sedatives and stimulants, and about half of them were opioid overdoses.
So we're seeing easier access to very potent substances, including synthetic opioids or synthetic sedatives, which are often consumed by young people, not even knowing what they're using. So young people may be accessing these drugs that are cheap, that are in circulation, and not realizing how potent they are.
Dr. Chadi also points out that the overdoses reported in the survey do not account for all overdose cases in Canada amongst children and teenagers 12 and over, because those who did not receive pediatric care or were dealt with by a non-pediatric provider were not part of the study. However, he emphasizes that overdoses are now the leading cause of death amongst teenagers in BC and says it could happen in Quebec.
So what we've seen in Western Canada is that overdose deaths have become the first cause of mortality in adolescents, and that's a new phenomenon that we've only witnessed in the past 3 to 4 years. We suspected that the shift is probably coming also in the eastern parts of the country, with increases in overdose deaths related to opioids or stimulants or sedatives.
Dr. Chadi adds that it's important to address drug use and overdoses with teenagers, but with a careful approach that promotes dialogue.
Not sharing too many facts, sharing some that are impactful, and then starting a conversation on a level ground. And that's really what is also called motivational interviewing. So helping young people find their motivations around their behaviors to see if they can do things that are healthy and that make sense to them.
In Montreal, Gareth Madoc-Jones, City News.